Now it's my great privilege to introduce the wonderfully caring and distinguished psychiatrist, Dr. Jerry Rosenbaum, who will lead the seminar. Not yet, not yet. Jerry is the Stanley Cobb Professor of Psychiatry at MGH. He leads the second largest department at Mass General, which has a faculty of some 600 psychiatrists, psychologists, and neuroscientists. For 19 out of the last 22 years, most of them under Jerry's leadership, his department has earned the #1 ranking in psychiatry from U.S. News and World Reports. Jerry is a nationally recognized expert in mood and anxiety disorders. In 2016, he was elected president of the American Foundation for Suicide Prevention. At MGH, he's a trustee of Mass General, representing the chiefs of medical services, and a trustee of Partners Healthcare, representing the hospital. He's also the past chair of the hospital's Executive Committee on Research. It's a little-known fact that the Mass General has the largest hospital-based research program in the country, with nearly $850 million in research funds. This is more than the biomedical science research budgets at Harvard University. Finally, Jerry has just been appointed as a co-chair of the hospital's philanthropy program. So please join me in welcoming Dr. Jerry Rosenbaum.
So, you know, there are these treatments in medicine I'm sure you're familiar with where as you take them, the benefits sort of fade, you adapt to it, you get tolerant, and over time the impact is less and less. Relationships with Howard and Michelle and Carol and with the Leadership Council are just the opposite of that. The longer they go on, the deeper they become and the more they mean to you over the years. It's really extraordinary to think about that and the journey we've all taken together over these last 10 years. So Michelle and Howard, thank you so much for hosting us again for this seminar and giving a chance for me and the colleagues that we bring every year to talk about what we do and what we care about and to share information about this process of figuring things out and trying to make the world a better place for people who suffer from mental illness, psychiatric disorders. As Michelle mentioned, MGH Psychiatry has grown to be quite a large operation, sort of foxhole by foxhole, bit by bit. We call ourselves the coral reef because each program sort of finds its own little micro environment and niche to grow and expand. And we've grown to now more than 50 clinical and research specialty programs that cross all kinds of borders. They're around specific diagnostic categories like anxiety disorders, depression, schizophrenia, OCD, eating disorders, on, down to some very unique and special programs like the one you're going to hear about first today in our program. There are programs that focus on approaches, therapeutic approaches, specific types of psychotherapies, device-based treatments using new tools like TMS or phototherapy, light therapy, and traditional device-based treatments like ECT or deep brain stimulation, so programs that do that. We have programs that focus on looking at repurposing drugs that exist for psychiatric disorders and using complementary and alternative or so-called nutraceutical approaches and other complementary practices. We study yoga and exercise as well as treatment. And then there are scientific laboratories that are very strong, world-class, best-in-class in genetics and neuroimaging and molecular psychiatry as well, to try to understand right at the very foundation of neurobiology of why some people get these disorders and why they progress, why some people get better and some don't. You know, there's a crisis in, I'm sure you're aware of, access to care, any care, not even quality care. That's a whole other story. There's a shortage of psychiatrists in the country. Over the last 20 years, the number of physicians, which is still way short of the need, has grown about 50%, in psychiatry about 10%. And that shortage is even more amplified when we think about children and adolescents and child psychiatrists. There are around 8,000 child psychiatrists in the country, many aging, to care for the nation's 15 million children. So one of the things that we've evolved to do to try to do our part in this challenge is to go where we can go, do what we can do to disseminate knowledge about psychiatry in the brain, about treatment, and educate those who will have, patients will have access to through our academy and teaching programs. And now a new venture that we launched just in the past year we call MGH Visiting, where through telepsychiatry, teleconsultations, and even traveling, we're trying to deploy MGH psychiatrists and psychologists in remote or under-resourced areas around the country, and we've already had boots on the ground, as it were, in Maine to Hawaii, and in the first year have had about 600 days of MGH faculty resourcing these areas. We also try to communicate through our websites, providing resources for healthcare professionals, pediatricians, internists, social workers, nurses, and school psychologists in particular. We have resources for parents and teachers on everything from addiction to sports psychology to how to deal with challenging children. We provide educational resources for judges and juvenile officers. We have a program that's educating or supporting all the pediatricians in the state of New York. We have a program that's working with all the juvenile officers in New York to help them with their interactions with challenging young people. So although we have programs really for all age groups, in recent years we've narrowed our focus a bit for the young. Struck, as some of you will remember from presentations here in the past, Tim Willens and others, that psychiatric disorders mainly begin in childhood and adolescence. And that if you're going to do something about these problems, if you can predict and intervene early, you can mitigate the impact and the lifelong burden of these disorders. So we have narrowed our focus substantially to this idea that if we can intervene early, the trajectory of mental illness can be changed, its severity blunted, and the outcome improved. So you'll see today 3 of the 4 talks that we have are directly related to this vital area of interest on early intervention. I just want to mention on the format that after each speaker, we're going to try to see if we have time for a couple of questions. But as always, at the end, we're going to bring everybody up for a panel. If you don't get to ask your questions right at the time, there are cards in your packets that you can write a question on and pass them up, and we'll try to get them at the end.